Welcome to all of our attendees. Thank you for joining us here today with Community Health Resource Center. We have a very special event. It's a combination of a presentation and a panel. My name is Twin. It sounds like twin sister, and I am the program coordinator here at Community Health Resource Center. We also refer to it as CHRC. Now, without any further delay, I'd like to introduce Barbara Blaser. Barbara is a retired nurse whose rich journey through healthcare has given her a deep understanding of hospital systems and staff training. Now Barbara is the clinical director at Magnolia Wellness, where she provides consultations for adults curious about integrating cannabis into their palliative care.
Wow, hi, thank you so much for inviting us. I'm excited about this. I did share while you were out, I don't even know where you went, but when you vanished, I did share the fact that I grew up in a time when we used 2 tin cans and a string. That was how we communicated. So, this is going to be kind of an interesting experience for all of us. So the only thing that I would want to make sure that people understand is that many times when someone speaks, it's important for you to know whether they have a financial interest in anything that might make it seem like they're selling something, I guess I want to say. And so again, my name is Barbara Blaser, and up until COVID-19, I was working at Magnolia Wellness. And when it became obvious that as an older female with multiple health problems, that I was at risk, I was actually offered a voluntary layoff. So I haven't worked until about March 3rd. And I am still very interested, and I do phone consultations at no cost to patients all day long. So today, if it's okay, we're going to talk about, is cannabis right for you, and are you right for cannabis? And I have no way of knowing how many of you have ever experienced cannabis or whether you're cannabis naive, but we're going to talk about it because it's not the same for everybody. So how about the next slide, Twin? This is again a little bit about me. I was born in 1945 in a 2-bed hospital, and a lot of times people gasp when I say that. I was raised in a small town in Indiana, and I will tell you, we were very anti-drug, and in our mind, cannabis was a drug. I never tried it, never thought about trying it. In 2014 and 15, I was actually in a coma on a ventilator. When I was able to finally talk and feel the pain, my kids recommended I begin looking at cannabis. So that's what kind of brings me here, cannabis. I'm a nurse and I certainly support it. Next. And I really just threw this up, I think more so that people could see a little bit about the trajectory of cannabis. Cannabis has been around for thousands of years. I don't know that the dinosaurs munched on it, but certainly by the time there were cave dwellers, there are pictures of cannabis in the tombs in Egypt. There are the leftovers of cannabis. There were cannabis seeds there. And in America, it was legal until some politicians decided that they could not only make money, but they could teach some people lessons, and cannabis became illegal. And it was pretty much illegal until we got where we are about 2 years ago. So the key points about cannabis is that if you're going to use it, it's important to know if you're seeing a doctor, is your doctor on board? Is your family on board? And are you yourself on board? Do you know everything that you need to know to have a successful experience? So next slide. And we're going to kind of go through these, just walk through them. I can't see myself, so I don't know. How come I can't see myself? That's interesting. I have on lovely jewelry. I want to see myself. So I've been talking about cannabis actually for about the last 5 years. And what I've personally discovered is that it isn't for everybody. That for some reason, there are people who are either too frightened, too ashamed, that getting into cannabis isn't necessarily going to work successfully for them. So I got to thinking a lot about for when I was in nurses training, and Sibyl's an RN also, and she probably can speak to this, but when I was in nurses training, there were the 5 rights of medication administration. If you've ever been in the hospital, you know, they check your wristband and they look at the med and they read your chart. Are you the right patient? Is it the right med? Is it the right dose? Is it the right time? All these things that are really critical to successful use of any kind of medication. So I got to kind of thinking about, we should be looking at cannabis that same way. Are you the person that's listening to this? Are you the right person for cannabis? So what I've discovered, even in the East Bay, is that for many people, simply getting to a dispensary or having delivery. I live out in Pittsburgh and there is no delivery. So I have to know, am I going to be able to get cannabis? It doesn't do me any good to say, oh my God, I want to try that, if I don't know how to get it. If my daughter who I live with says, no, I'm not helping you. So you have to be able to get it. We have to look at the stigma, and many people, and again, I'm sure the panel will be able to talk to this, there's a stigma about using cannabis. My daughter Debbie is a leading cannabis advocate and has been since she was in college. And my dad would say, well, what does Debbie do? And I'm telling you, Debbie has worked in the cannabis industry for at least 25 years. And I would say to my dad, oh, she works for an alternative crop lobby group, because I was afraid of the stigma. I was not loud and proud about it. So if the stigma that your friends or family might heap on you is going to give you a negative experience, you need to deal with that and talk to somebody. Another issue, and for me, this one is similar too, if you've ever known a diabetic and they have to take a certain dose, are you as a new patient able to control your dose? And if I could, I'm gonna hold this up. This is actually a cannabis tincture, and we're gonna talk about cannabis tinctures. But cannabis tinctures, oh, look at this, it's not gonna come off. They have a dropper. Never mind, by the time I get there, they have a dropper. But you have to be able to see the dropper. You have to be able to measure your dose. If you're gonna take drops, you need to know how to do that. And then the bottom one on here is that cost. Can you afford cannabis? And that's a significant question, because cannabis is not necessarily cheap and it's not covered by insurance. And there aren't drug companies who say, oh, I'm going to pay for it for you. So those are some things you have to think about. Next slide. Is cannabis right for you? Boy, oh boy, wouldn't it be nice if cannabis treated everything? And it actually treats many things, but it doesn't treat everything, and it doesn't work for everyone. So I personally, and as an RN, as an RN, I can't prescribe, I can't recommend. I really am not supposed to talk about this, so don't tell anybody we're talking about that. But I started using cannabis for insomnia, anxiety, chronic pain, and PTSD. Those are the 4 conditions that I use cannabis for. But you can see people with cancer use it to treat the anorexia. Some people say that it works for hair loss if you have cancer. Yeah, it can do almost anything. The people that I know that first were using it had glaucoma and had miraculous results. So I meet with seniors all the time. I meet with seniors in particular almost every day. People will call and say, you know, my grandson said I have to try this, but I don't want to get high. So I wanted to just briefly talk about the fact that there are 2 different tracks that most people are on in the cannabis world. When I came into cannabis, medical cannabis was legal in California, and you had to have one of these diagnoses that were up here in this little paragraph ahead of that, or something that acted similar. So if you didn't have chronic pain, but you had acute pain, or you could say, I need medical cannabis, and a doctor could give you a recommendation. In 2018, adult recreation became legal. And if you are 21, you can go to a dispensary without a doctor's recommendation and get cannabis. So a lot of people came in, and I know I have a minute on each slide, but a lot of people came into the dispensary on January 1st, 2018, and said now that it was legal, now that they could use it, they didn't want to get high. I thought they didn't want to get high, but they wanted to try it. And I've shared this story before. The first patient that I remember coming through the door was an 85-year-old lady dressed like she had just come from church. And I introduced myself and I said, well, for sure you don't want to get high, right? And she said, the hell I don't. And she explained that her and her friends had all gotten to be in their 80s and they never tried cannabis, and they wanted to get high at least once before they died. And they wanted to buy a pound of pot. Well, you can't buy a pound of pot, it's against the law, but they did come and have high tea. They had high tea at Magnolia, and they had medicated tea, and they had cookies and candy, and they stayed until they got high, and then they stayed until they came down from the high. But so there is a difference between adult rec and medical, although I will tell you that I believe everybody is medical. That you would be surprised at the people who came in for adult rec and said, I've never slept this well before, or I had this terrible pain in my back, and ever since I've been using this, it's made a difference. So I believe, and many experts believe, and I am not an expert, write that down somewhere, Barbara's not an expert, but many people will tell you that it's life-changing in the medical realm once people start it. So I think that if you have a question or I'm going too fast, you should let Twin know. But cannabis doesn't cure everything. There are things that cannabis can have a negative effect on, and that when you go to a dispensary, you should already have looked it up. You should at least know that there are some things that can be negatively affected by cannabis. And again, I get to talk about myself, which is great, and it saves my husband a whole lot of listening. But I wrote down here, do you have any medical conditions that can be negatively affected by cannabis? And so I have a history of blood clots. When I was in my coma, I had a pulmonary embolus, and I actually had 2 blood clots. And so I take Coumadin every day, and I test whenever I need to. And when I use cannabis, it changes my bleeding time. So I call the Coumadin lab at Kaiser and I say, hey, it's Barbara. And they said, I add cannabis, right? And they change my dose. They have me draw my blood again, and they change my dose. So if you have a history of blood clots and you're on Coumadin, you need to be careful. There are other meds that have similar things. One of the things that a lot of people talk about when they are taking THC, which we'll touch base on, but that's the component of cannabis that can make you go, woo! But it can also increase your heart rate. It can increase your atrial fib. So if you have a known heart condition, you're going to want to make sure that you talk to the people before you start taking it. I want to tell you that I also have a thing called tinnitus, and that's ringing in the ears. And every day, all day, 24/7, it's 100 butterflies. They're flying around, they're having a good time. They don't bother me, I don't bother them. But if I take an extra dose of cannabis, it becomes 1,000 angry bats. And it's horrible. But before I take that cannabis, and I want you to think about this, I know what's going to happen. So I do what I call a risk-benefits analysis. Is the risk of the pain or anxiety that I'm having greater than me being able to bear these bats for a little while? So every time I decide that I'm going to use cannabis, besides my regular dose, because I take a dose in the morning and a dose in the afternoon, I evaluate how important it is to get relief. And usually relief wins out. And then the last thing that I put on this is, do you need to worry about having a positive drug test? For those of us that are still working, you want to know that THC will make you have a positive drug test. So you might not want to take cannabis at this time. So we're going to go to the next slide. I'm going to look at this question real quick. cannabis in your memory. I love that. I'm going to close that. Cannabis and either Carrie or Sibyl, if you want to leap in on this one, it doesn't necessarily affect your memory. You have to take a lot of cannabis to have it affect your memory, but it's at least something to be aware of. So we'll talk a little bit about that. Thank you for that question. So is cannabis, did we do both of those? Are we ready for what's the mode of ingestion? I'm ready to go there. Twin, if I've done something wrong, honey, you just let me know. So what mode of ingestion is best for you? And if I was going to tell you for new cannabis users, what's one of the most critical things to know? You have to pick the mode that's best for you. And it's interesting that a lot of people don't understand this, that we all think, okay, well, first of all, you don't have to smoke in order to ingest cannabis. You don't have to smoke. And in particular, right now with the COVID virus, and we know that it affects your lungs, might not be the time to start smoking. But cannabis, if you can eat it, wear it, drink it, put it on your skin, you can get it in cannabis. And so the first thing, though, that you need to decide is, do you need a fast acting, or do you need something that takes a while but lasts longer? And that's interesting. And tinctures in particular are very fast acting. They take 5 to 7 minutes. They go up into your brain. They're almost instantaneously ready for you to use it. So that's for fast acting. And a really good example for me is, I go to the grocery store, I'm in my mask, I'm keeping 6 to 8 feet from someone, and somebody slams their cart up under my foot. You're not 8 feet away, and you're coughing and you don't have a mask on. I might need a short, fast-acting tincture really quick while I'm standing there. Or I might be able to wait. I'm going to wait till I get to my car. I'm going to bite a cookie. I'm going to drive home. By the time I get home and my husband says, well, how was the grocery store? I don't go, well, how the hell do you think? I have to look at how much time I have to feel relief. So what mode of ingestion is best for you? The other thing is, if you happen to have that GERD, a lot of people have GERD, that heartburn, that when you burp every once in a while, something horrible feels like it's in your throat, then you want to look at what kind of cannabis you're using. Let's go to the next one. So modes of ingestion, tinctures, and that's what this is. This is a tincture, and normally I push down and I turn it and it comes off, and I should have practiced it because it's not going to come off, but it's got a little dropper. You start low and go slow. So maybe you're going to start with 5 drops. You're going to put it under your tongue, I actually recommend putting it in a spoon. Put your drops in a spoon, put the spoon under your tongue upside down. It usually works in 5 to 7 minutes, and the relief actually lasts for 2 to 4 hours. So I use tinctures in conjunction with edibles. If I go to bed at night and I take an edible and I go to sleep, but I wake up 4 hours later and I'm in a panic, I can take a tincture, doesn't impact on my edible, and I can get relief from that in 7 to 10 minutes, and I can be back asleep for another 2 to 4 hours. So it's easy. I have to tell you, it doesn't taste good, but it doesn't matter to me. It's only going to be under my tongue for 60 seconds. I can handle that. So those are tinctures. Let's look and see what it says is next. Good job. Mode of ingestion, edibles. I wish I knew if anybody had ever tried an edible. So these are actually Breeze mints, and I do use Breeze mints. I also use a Breeze spray that goes under your tongue, but it doesn't taste so bad. But so the thing that I like about these in particular is that you can see there's maybe 20 tablets in this. Each of them is 5 milligrams. I don't have to worry about what my dose is. 5 milligrams is fairly small. It works in 2 hours. It says don't repeat it before 4 hours, because a lot of times people will call me and they'll say, I almost died. Oh my God, it was too much. I almost killed myself. And then I'll say, well, what did you take? Well, I took one and it didn't work. So after an hour, I took a second one and it didn't work. So I took another one. Well, now you've triple dosed yourself. And if they all start working at exactly the same moment, you're not going to feel very good. But edibles for me are wonderful because they last for up to 8 hours. So if I'm getting on a plane, not anymore, but if I was getting on a plane and I had anxiety, I could take one of these. It would start working before I got on the plane, and it'd still be working when I got off the plane, and I wouldn't be high. So start low and go slow. That might mean that you're going to cut a gummy into 4 pieces, but a lot of times they're easy to do. So edibles, keep that in mind. Takes a while, lasts a long time. How about the next slide? Ta-da! Oh, look how cute I am. I did a shoot for San Francisco magazine, and they said, okay, now you're going to smoke. No. So they had to let me put a tincture on my neck. Very fake, or a topical. So these are topicals, and I love topicals. You can put a topical anywhere. I have these topicals, and this is a spray, and you just spray it wherever your pain is, and it stays where you put it. So topicals can be used for things like, if you have herpes zoster, if you have shingles, you can put a topical on those shingles, and it can help relieve that pain and promote healing, because most of them are anti-inflammatories. So I have tendinitis. It's good for tendinitis. People who have really bad migraines will put it on the nerve tracts. I know people who use it on their sciatic nerve, and that helps. It works pretty fast, 10 minutes, lasts 2 to 3 hours. You can repeat it as often as every 2 hours. The key is it doesn't get in your bloodstream, so you're not going to pop positive. So that's a really good thing. Topicals. Okay, next. Transdermal products. And Carrie, I saw that you had some Mary's Medicinals with you. So maybe if you've got a question, she can hold up hers. I did bring this. Let's see if I can get it in there. Well, I forgot where I am. The transdermal gel pens, a transdermal product gets into your bloodstream. So the transdermal patches can last 8 to 12 hours. You open it, put it on a clean spot. A lot of times people put it on their back or on their shoulder. What it does is it releases usually 2.5 milligrams for the entire time that it's on. So it's a stabilizing dose. I hear a lot of people who, for instance, have a family member that's in hospice, that they will use this in conjunction with other meds. Most of these are low doses, 2.5 milligrams. If a person has more pain than one patch, you can put 2 patches on. They're clean, they don't smell, you don't have to worry about them. When the medication's gone, the medication's gone. If a person says, I just don't feel good, I think this is making me sick, when you take that patch back off, you get automatic, almost immediate relief from it. So it's pretty safe, but it will test positive if you're using a THC or something like that. Like this one that shows here is a CBD, that's a non-psychoactive product. But it really works well, and it's easy to do. I know when the pens first came out, this pen has 50 doses in it. Every time you push it to expel a dose, you get 2.5 milligrams. A lot of people, and this was kind of interesting for me, a lot of people were buying it to take to concerts and ball games because security wasn't checking for these. They look like Tampix. They're pretty benign looking. So nobody knew to ask what that was in somebody's pocket. It wasn't like if you had a joint in your pocket. So that top transdermal products. The next one. What's next? Oh, I just kind of wanted to touch base on, Almost everybody has heard the acronym THC or the acronym CBD. And the cannabis plant itself has over 200 things they call cannabinoids. THC is one. Again, THC is a product that kind of makes you go, oh, baby, party time. And people said to me that I should not see the Black Panther movie without being high on THC, that would really make it very, very cool. Well, it's about as cool as I could take regular, but that THC is one thing that you can take. And depending on the dose, it doesn't get you high. That's a fallacy. Everybody that takes it doesn't get high, but you got to dose apparently carefully. CBD is the thing like, hey, babe, yeah, come on up, okay. In my day, we would look at etchings, but I don't even know if people do etchings. So CBD is the second product, mellows you out, good for inflammation, good for pain, that kind of stuff. And this is just a picture of the cannabis leaf, and those are the little chemical makeups of it. So just wanted you to see that. How about the next slide? Oh, cool. Just some tips to be safe. You will hear me over and over say, start low and go slow. Start low and go slow. You can always take more. It can take the body 3 days to assimilate a dose of cannabis. So if something doesn't work, don't throw it away, because people will come and say, I tried it twice and it didn't work, so I threw it away. Well, if it was $80, don't throw it away. Save it. It's probably you're not dosing right. Never drive while impaired. Don't plan on driving after you use cannabis. So I normally would ask people to start it maybe on a Friday. If they were going to be home on the weekend, I would ask that they have somebody that knows what they're doing. If it's brand new, that they don't take something their neighbor said, oh my God, you're going to love these brownies. I don't know what's in them, but you're going to love them. Don't eat those brownies. Get your meds from somebody you can trust. And somebody else can talk about whether you can mix cannabis or alcohol. I think that you're always on the edge then of getting into a danger zone. For one thing, some cannabis is assimilated in your liver, and alcohol is also in your liver. So you want to be a little bit careful about that. You want to ask about your prescription meds. If you are on an antipsychotic from your psychiatrist, you'll want to know how that might be affected by the cannabis that you might be using. You need to store it safely. People say, well, I keep it in my dresser drawer. My kids aren't going to get in there. I was in my dresser drawer, or in my mother's dresser drawers whenever she was in the bathroom. Don't put it somewhere that a kid can reach. So because I came from hospice, we would recommend people get a locking fishing tackle box, and you would put it in there and you would lock it. And, tell your kids it's medicine, it's poison, it's whatever you need to do without stigmatizing it, but keep it away. And it can be dangerous for pets in different doses. Make sure you understand the time that it takes to work. It can work edibles in 2 hours. Don't repeat just because you think it's not working. They can sneak up on you. I think that cannabis is so much safer than everything else that we see on TV. I watch those commercials where they say, blah, 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 can't hurt you, blah, 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 and death has been known to occur. There has never been a reported death based on cannabis use. And I think that's good to know. I think, though, that one wants to be careful just in case. In particular, if you have an overarching medical condition that might interact with this, that you'll want to be careful. Start low. Go slow, ask somebody. That's the key. So next slide. Thank you for listening. The whole idea of this presentation was really to let you know that cannabis is really good for almost everyone, that there is a cannabis product that can change your life. So if you have anxiety, if being home with the COVID virus since March, if you find yourself irritable, wouldn't it be a whole lot easier to maybe use a small drop of a transdermal product rather than call the world to tell them what you think about them? I think that it can kind of change your relationship with your family. I'm isolated here with a husband of 30 years and 2 grandchildren. And when I come out this afternoon, somebody's going to tell me they're hungry and want to know what to eat. And I may use cannabis before I walk out of here, so I don't tell them what I think about that. So my hope was that you would have questions and that the panelists, and I will tell you that they know way more about way many more things than I know. And that's the coolest thing about being 75, that if I knew it, I may have forgotten it, but I know where to look for it. So this is my email address. And if you have a question or a concern, you can reach out to Twin and she'll find me.
We introduce you guys to our panelists and our moderator. First, we have Carrie Tillman. Carrie is a patient and advocate for cannabis. She suffers from a rare condition in which cannabis helps to transform her quality of life. As you also know, she helps educate with Barbara, and they work together closely. They share a lot of information, and so Carrie is a really resourceful source for cannabis education, particularly from her perspective of suffering such a rare and painful condition. We also have Sibyl joining us. Sibyl is takes on the holistic perspective of cannabis. She studied the medicinal usage of it from Amsterdam University. She is a hospice nurse and also considers herself an advocate. Our moderator is Reba Hsu, and she actually previously worked with Community Health Resource Center. She is currently studying at Columbia University to become a social worker. She currently works right now at UCSF. And then there's, of course, Barbara, since you've already met. For now, I will also hand it off to Reba to moderate and step back into the background and help collect your questions and answer anything that you chat to me.
Thanks so much, Twin. I did see that question, and I'll be sure to get around to it. Barbara, thank you so much for that comprehensive introduction for the cannabis naive. I want to first get back, I want to just jump right into the questions that we've received, and one that came up first that you started to address, but I wanted to give you and the rest of the panelists a chance to talk about was the effect of cannabis on memory.
All right, so when it comes to cannabis of memory, I think it's really important to understand that there's so many different types of cannabis that you could be talking about one particular part of the cannabis plant like CBD, or you could be talking about THC, and they have such different effects. One of them can actually enhance your memory because it isn't psychoactive, whereas the ones that are psychoactive can affect short-term memory, but it always comes back as long as you are using everything moderately and you have the appropriate nutrition and the right amount of sleep. That short-term memory loss should reverse itself.
Hi. Yeah, cannabis is like any other medication. It may work for some people, it may not. So, you just have this trial and error. So it doesn't work for everybody. Some people it may help with memory, and some people it may not. So you just have to consider that it's like any other medication. It doesn't work for everybody. And you have to determine whether or not if it's right for you and you're right for it.
Right. And just today I was talking to a patient who had a bunch of questions and said how things made her feel. And she was a little concerned about memory. And I asked her if she was keeping a journal, because I always suggest to people, especially if you're new, that you should write it down. Because if you call me in a week and you say, oh my God, I was so sick, I thought I was going to die. And I say, well, what did you take? Well, I don't know exactly what I took. Memory can be funny. So I think that if you are thinking about trying cannabis for the first time, you want to start writing notes down. What did you take? What time did you take? When did it work? How did it make you feel? And did it affect your memory? But I think, like both of you said, it normally comes back. It doesn't wipe your memory clean.
No.
And also with that in mind, there's some reasons to look at cannabis if you have specifically issues with Alzheimer's disease or dementia, because there's some evidence that, THC and CBD work together to reduce the inflammation on the brain, And they can also kind of take back some of that scarring, that protein buildup that can be such an issue with particularly Alzheimer's.
And it's great that you brought that up, because people ask me, well, how or why did you really start that? And I did go to Oaksterdam like Sibyl did, but I also read, there's a newspaper that's called, oh my God, what's Fred's magazine called? I just lost the name of what's Fred's that newspaper. O'Shaughnessy's Press. Yeah. There's a press that's out of Alameda, and the first issue I read was actually on memory loss. And what they found in Israel was that, and they did CAT scans and MRIs and all these different studies of the brain, and they found actually that 10 milligrams of THC a day improved memory and improved the brain function. And so that's actually what I started with, was 10 milligrams a day of THC, 5 in the morning and 5 in the afternoon. And I took it for maybe, 6 or 8 weeks. And I thought, well, it's not doing anything. It's cost a lot of money. And I stopped. And about a week later, my husband said, could you go back on that, please? So apparently that extra effect was that I wasn't as anxious as I had been. So I do think that reducing the inflammation of the brain can make a huge difference when you're using cannabis.
I'd like to make a side point too. You were talking about risk-benefit analysis before you decide whether or not you should take cannabis. And I think sometimes it's also about reducing harm from other options that could cause permanent memory loss. Part of my story is one of trying to do everything the quote unquote right way within Western medicine, and doing everything that the specialists want you to do and all the medications they want you to take. And there is a cumulative effect that happens where you get started down a road of trying to manage an acute condition, and you get on so many medications that before you know it, they're having a real impact on your brain's function. And it's hard to walk back. So I think sometimes when people are looking at cannabis, they're looking at it because the things that they're already considering taking or are taking have significant consequences to their cognitive function and to their daily quality of life.
And that's good that you speak on that. That's one of the good things about cannabis, that it's a pretty safe medication, as opposed to all of the pharmaceutical medications have adverse side effects, even aspirin. So that's one of the beauties of cannabis. It's pretty safe.
Especially for withdrawal. So if you can't get to your pharmacy to renew your medication, and it's a medication that causes you to be dependent, which can be a surprising range of medications, not just pain medication or antidepressants, but there's a wide range of medications that have a cost if you stop taking them. Then with cannabis, if you stop taking cannabis, that's it. Like, there is no withdrawal. There is no, a physical cost to you not taking it anymore. It's just that you don't get the relief that you used to get from it. There is no long-term impact to you. It's not as dangerous. So that's one of the reasons why it can be a good alternative as well.
Right. And one of the things that we didn't talk about in the length of time that we have is that you don't get addicted to cannabis. It affects the brain differently than, say, cocaine affects it. It doesn't leach on to those cells. So when you stop using cannabis, it's gone. It does stay in your blood system, and it does stay in the tissues that store fat. It does stay there for a while. That's why hair follicles. So if you're going to get tested and you've been smoking pot for 15 years, but you stopped yesterday because you were getting tested, it doesn't go away that fast. It's got a half-life that it's saved. But you can't get addicted to cannabis, and that's key. You cannot get addicted to cannabis. And I tell people that all the time. And, now that we're on tape and I've said it, who knows? But I tell people that sometimes if in my head, I think I'm addicted. If I say, oh, I have all these symptoms, I have to be affected, then you can talk yourself into that. And I do share with people all the time. I'm one of those people, and Sibyl, I don't know how you were in nurses training, but when I was in nurses training, I caught whatever we studied. And people laugh at that, but I say, I almost died of prostate cancer. I mean, if we studied it, I got it. So if somebody says to me, this is going to make you feel better, I'm going to think it's going to make me feel better. And I get that placebo effect. So I want people to understand that a key is to talk to a knowledgeable professional. And whether that professional is the bud tender at the dispensary that you choose, who's been trained, or whether it's Carrie. And Carrie, I know I can, when you're in the big screen, I can read your logo here. But there are people who are out there and who can help you make informed decisions. I just want you to kind of know that.
Can I just add one quick fact, which is cannabis is about as addictive as coffee. So you can't say that it's not addictive, but it's rated in the studies as just as addictive as coffee. So.
Cool. I did not know that. Thank you.
And two, I think people need to understand, the question is right for me. You have to understand that it's still illegal at the federal level. It's still a Schedule I drug. Therefore, there is research out there, but no research based on the federal government. And you must know that if you decide to use cannabis, that people do it for younger people who are still working in working class. You still need to know that, you know, if you're going to be tested at work. So all that needs to come into consideration as well.
Well, we really totally went off on the question of memory there and covered a lot of ground. That was great. I want to come back to the different modes of consumption because someone had a question about tinctures and are there different ways to consume them? I think, Barbara, you started to talk about you like to use the spoon method where I think you said you take some drops on the spoon and put it under your tongue. But I was wondering if you could expand on that. And then I'd actually love to, you know, just go around and all the panelists maybe talk about your sort of preferred method of consumption and any thoughts on, you know, what the safest methods of consumption are, or if they're like some are more safer than others.
Wow. Carrie, do you want to do first?
Sure. So safe is relative to what your definition of safety is. Mm-hmm. Do you want something that you can back out of real fast if you don't like how it feels? If you can do that, you can set yourself up to be safer by always keeping CBD on hand. So this is a trick. If you feel uncomfortable with a product that you've tried that has cannabis in it, and then you try CBD, this is a CBD spray tincture, so it's really fast acting. It goes right in your mouth. It's a different version of the same kind of product that Barbara was showing us before. CBD can take back that THC effect. It can tamp it down. They work together to level out a high that you are not enjoying. So that is one of the things I question about safety is can I press undo if I don't like the way it feels? I am a mom to a very young and active kid. And because of that, I keep this on me most times, just in case I need to, you know, really zone in and respond. So the other ways I measure safety, go start low and go slow is the best advice you can give because it's a lot easier to add than it is to take away. So I use a lot of microdosing, like these edibles by Camino are really great because you can get them in different measurements of CBD and THC. So you can really control that intensity that, you know, you're either trying to avoid or you're trying to seek. So I would say, you know, small doses, build it up. And that's one way that you can build safety into your choices.
Sibyl, how about you?
It's an individual preference, but as Carrie said, to start low and go slow until you know what effect any mode that you do, whether if you smoking is kind of instantaneous. It's easier to titrate because you feel it right away. Edibles, it takes a little bit longer for the body to metabolize it. So it just depends on the individual. But to go slow and low to start.
Right. And I mean, I think that those are the safest things to do. Tinctures, to the best of my knowledge, when I think tincture, they always go under your tongue, although kin slips can go on top of your tongue. The whole idea about tinctures is that this is a very vascular area, and when they get absorbed, they go up into your brain, and they're almost instantaneously available, in comparison to edibles that have to go through your whole body and get into your liver and get cleansed there, and it changes your doses. So the interesting thing for me about, one of the interesting things about cannabis is it can take 3 days for you to really know how it's going to work. So if you've taken the same dose for 3 days and it doesn't work, it's possible that you might double that dose. So if somebody says start with 5 drops, and after 3 days, maybe you take 10 drops, and then maybe you take 15 drops. I mean, you're looking for that sweet spot that's not going to impact how you feel. So for me, I used tinctures, only tinctures, for about 2 years. And then I branched out into edibles. And for me, the issue with edibles was, oh gosh, so I'm 6 feet tall. I'm a big girl. You know, when my doctor told me I had a medium frame, I said, oh, no, I'm a big girl. I'm a big girl. And I would dose edibles like that. My doctor said, buy a candy bar, break it into 16 pieces and eat 1 piece. I can't do 1 piece. That's, 1 piece. I've never eaten 1 piece of a Hershey bar. So a patient said, break it up, put 1 piece in each little Ziploc bag, and then fill that bag with Hershey bars. So I'm getting 1 small dose, probably 1 milligram or something. You have to be careful with dosing, and you have to, I think, practice and start low and go slow. Carrie mentioned that you can use CBD to counteract the effects of THC. We didn't talk at all about terpenes, but terpenes are something that gives cannabis part of its flavor, but also enhances how it works in your body. And there are terpenes that are the anti-venom to the high. So if you got too high on THC, you can actually just sniff black pepper or lemon peels, because those are terpenes that are antagonistic to THC. So there's all sorts of tips and things that your bud tender should be able to tell you. And if not, you can ask them, and we'll all come back and we'll do part 2.
And I think we left out topicals, which are probably the safest way to try to get physical relief, especially I call it spot on, put it on the spot that hurts. And that way you're not going to get high. You're not going to get any of the psychoactive effects that might give you the anxiety that you're already kind of anticipating, because you're asking what's safe versus scary. And Barbara asked me to show you, these are the patches that we talk about. Really safe, really easy way to know exactly how much you're taking, how long it'll last, and you put it where it hurts, preferably in a very vascular area so it can absorb the medication through the skin. So that's a good alternative as well.
Yeah, I think we're going to close out very quickly, but if I could just say something, because I worked hospice and I worked long-term care. I was the director of nursing in long-term care, and we know that cannabis is it's still a federal no-no, and people will try and sneak things in. If you are listening to this presentation and you're thinking, I'm going to give this to my mom, I'm going to start when I visit my mom, I'm going to put it in her feeding tube, and the nurses will never know. If your mother has a change of behavior and the nurses don't know that they've had cannabis, they might treat it differently than how they would treat it if they knew. So cannabis is not something that one surprises someone with. Or a lot of times people will say, oh, my friend was driving me crazy. And I said, here, just have this candy bar. And no, don't surprise anybody with cannabis. You need to have informed consent before you do that. Make sure we all know what we're doing. Cannabis can be a lot of fun, but if you're not expecting it, it cannot be quite that much fun.
That also goes for having the great idea to send your friends care packages, especially if they live in one of the 30 states where it's still illegal. So we talk about federal illegality, but state laws matter just as much. So you don't want to visit a state that does not allow access with medication on you. You can face a lot of consequences about that. And even in states where it is legal, like California, you need to pay attention to the policies of wherever you are, because Disneyland, for example, you cannot have any medical cannabis products on you whatsoever. So it's really important to stay cognizant of the fact that this is still a very illegal federally drug, and because of that, a lot of people have lost their freedom. A lot of people have made sacrifices and lost access to their family. So it is not just a joke of I'm going to bring my mom some gummies over Christmas break. It's a pretty serious decision. That's why when we talk in this session, we talk about individual choices, because you are only talking about choosing medication for yourself.
Wow, so much wisdom once again. That I really appreciate that reminder that even though cannabis itself is on the whole very safe, it's not safe in our legal system on the federal level. And it's really important to remember that, especially if you are a person of color or anyone who has been criminalized by, the way that we treat drugs in this country. We have a question about the long-term benefits of cannabis, which I think is interesting, because I think a lot of the time people are sort of concerned about potential long-term risks, but this person is wondering, are there long-term or lasting benefits from cannabis even after you stop using it?
So I would say that those are going to be so individual. If I am using cannabis right now because of the COVID virus, that my anxiety is off the charts, and I am able to eventually get the vaccine, then I won't need that cannabis. It doesn't stay in your body you don't get a therapeutic level that lasts forever and ever. If you're able to deal with whatever issues you're taking it for, if a medical condition resolves itself, then you'll have some lasting benefits, but it's not something that's going to change your life and you never have to use it again. To the best of my knowledge, nothing that I've read has indicated that, boy, you're going to feel good for 10 days or something, not to my knowledge.
For me right now, the benefit of using it is that there are no adverse side effects. It's a safe medication. You can't die from it.
Right. And people are able to go to work. People are able to work unimpaired. When I was working at Magnolia, we had a lounge where people could bring their laptops and work all day. If you didn't have an office, you could stay in and work and not be impaired. It's very funny when you think about stigma. If you ask people, what does a pothead look like? It's nothing like the people that are currently using cannabis. We're just regular people who have discovered something that can help us maintain the highest quality of life possible. If you had told me at 75 I could still be working and enjoying most of life, I would not have believed that. And there are many days when I watch TV and CNN that I think, oh, I need more cannabis. But, it can be life-changing. It can enhance your ability to garden. It can change almost everything. It really can. People who say, oh, I'm too depressed to eat, smoke a little cannabis. If you have Parkinson's, it can relieve the tremors. Even just a little tremor can be relieved with cannabis. So there's lots going on out there. And we want people to learn as much as they can.
And I would add, we talk about the safety, we talk about the long-term, shorter, long-term negative effects. Let's look at the science. If you go to projectcbd.org, if you go to their website, you can find data, peer-reviewed research on all kinds of medical conditions, organized by condition, really easy to read. And if you look at the long-term negative effects, there's one that all the research points to, and that is it has a chronic effect on your teeth, your periodontal health. So the biggest thing I would say for that is brush your teeth, use a mouthwash. You know, tinctures, when you use them in the middle of the night to get back to sleep, that is going to stay on your teeth. So that's the kind of, you know, think about it and figure out a way that you can maybe have a hygiene routine by your bedside if that's something that you use during the night, because that is what the peer-reviewed science says worldwide is the only long-term negative effect of chronic marijuana use is your periodontal health.
Yeah, I did see a question about a person who said that when they wake up in the morning, sometimes they feel a little bit hungover, and was there a food or something that we might recommend? And what I as an RN would first want to do would be examine what you're taking when you're taking it. If you're doing an edible and you know that edible is going to work 6 to 8 hours and you're going to get up to go to work in 4 hours, yeah, you might want to take it earlier. When I first started using cannabis, I was very fearful that I would take the cannabis and I wouldn't wake up to go to the bathroom. That was huge. I'm an old lady. I did not, you know, I did not want that to happen. And I worried that I would be off balance, that I would walk into the wall, that I would have a fall or something, or that I wouldn't feel good in the morning. So it took me a long time to figure out my doses. I use cannabis at 8 o'clock at night. And I actually, and this is probably the last thing that we're going to be able to say, but I use an edible and a tincture at 8 o'clock in the evening. Because I was in a coma on a ventilator and had surgery, this is my chair. I have to sleep in this chair. I can't lay down, so I have to sleep sitting up. So at 8 o'clock, I take a tincture and an edible for my anxiety and my insomnia and my pain. And so my tincture starts working in 7 to 10 minutes. It allows me to take that kind of a yoga breath and start relaxing and go to sleep. It lasts for 2 hours. It's ticking away. At the end of the 2 hours, it's gone. When my edible kicks in, my edible is good for 6 to 8 hours. So if I took it at 8 o'clock and it started working at 10 o'clock, then I'm waking up at 6 and I'm feeling good. I can get up, get dressed, and I could drive into Oakland and be at work. So if you have a problem or a question with something like that, please contact us. I mean, you can call me. I'm more than happy to talk to people about it, but you should not be waking up not feeling good. Mm-hmm. So that, I just want, you know, that's a dose concern.
I think it might also be a good time to point out that there's more than cannabis and cannabis products. So you might be reacting to the oil in that tincture, like coconut oil, or you know, sometimes they use the MCT oil that might not be interacting well with you. And so you need to look at the actual product and what's inside of it. And with that, if it's okay, I'd like to go to the question that asks about testing and how do you know what's in your cannabis? If you are fortunate enough to live in a legal access state with dispensaries and you are buying from a licensed dispensary, that dispensary has tested all of their products. You have to have a product on the market, and it has passed the threshold for pesticides, lead, you know, tons of other chemicals that they're testing for. But if you are buying, especially CBD, from a gas station, from a drugstore, from your, you know, local chiropractor, because that's a big place where people can find CBD, that CBD is hemp-based. It is not required to go through any regulatory testing at all. And in fact, the last time that a huge study was underdone that tested hundreds and hundreds of supposed CBD products, over 80% of them did not have what they claim to have. So it's actually really important that if you do have access to regulated cannabis, as we call it, that you use that access if you have a medical condition, because it matters what you're putting into your body. And that's how you can make sure it is what it says it is. And then you can write it down and write down the effects it has on you on your journal. And then if there's anything that you have to be concerned about or questions that you have, you can bring that to me, you can bring that to Barbara, you can bring that to Sibyl, and we can figure out what is causing you to feel what effect and how you can replicate it or avoid it.
I just wanted to go back to the question about feeling a mental hangover real quick, because I think there was a sort of part of that question where, is there any difference between sativa and indica when it comes to side effects like a mental hangover or something?
So, and all I can do is tell you what I understand. In the good old days, there were sativa plants and there were indica plants. And pretty much all plants have now mixed, and that almost everything is a hybrid, that it's going to be very difficult to find something that's exactly a sativa or exactly an indica. A sativa, historically, people would feel high from a sativa. It gives you energy, excitement, kind of gets your brain jangling. So the effect that you might feel later would be different than an indica, which might tap it down. I actually went to a lecture out at Rossmore, and the doctor that did the lecture was talking actually about people with epilepsy, children in particular with epilepsy. And what he said was that in the brain of most people, our brain all day, and I don't know how many people have ever used a pressure cooker, but for many of us, our brain all day is going, and so we're just kind of mellow. But if you have Parkinson's or you have epilepsy, your brain is going, and what they found is sometimes with a single dose of cannabis, it can impact on those synapses and it can interfere with those nerve firings. So almost immediately you get relief from that and your brain resets itself. Now, I know somebody was asking about smoking, the difference between flower and tinctures. And for me, the difference is, what are you treating? What are you using it for? Because when you smoke a flower, you get almost instantaneous relief. So if you have an essential tremor, or if you have, I knew a lady who had cerebral palsy and she had a really bad stutter, and she could take a couple smokes and the stutter would go away. It was instantaneous. People who can't feed themselves because of Parkinson's, one puff on flower can make that difference. But for most of us, it can impact on our lung function. And in particular, right now, I think for me, it's better to be safe than sorry. So I mean, I think that there are a lot of things that affect it, and a lot of it has to do with that start low and go slow. It has to be safety first. You can't ever believe, oh, my best friend told me. So when I started at Magnolia, we actually had a cookie called the Big Cookie. And it was 500 milligrams, one cookie, 500 milligrams. And when the law changed in 2018, the state said a bag couldn't have more than 100 milligrams and it had to be easily divisible into 10 milligrams. My average dose is 5 milligrams. A 500 milligram cookie would have been 100 days. But what if I didn't understand that? What if no one explained doses to me? And what if my brother was sitting across from me and he was mowing on this cookie like it was nothing? Well, he's going to get in his car and he's going to drive home, and I'm going to call 911 because I'm having palpitations and I'm paranoid. You got to start low and go slow. Find a trusted source. Read as much as you can. Project CBD is amazing, and talk to somebody about it.
And I would add the other perspective, the other extreme of that, which is, let's say that you're in chronic pain all the time, and cannabis is how you can function. You can move your body. You can have a conversation at all. That's where concentrates can come in, and they can help somebody who has developed a tolerance high enough to cannabis that flower by itself is not necessarily going to give them the relief that they need to function. So when we talk about concentrates versus flower, the big thing to remember is that that is a whole nother level of professional cannabis use, I would call it, because you're talking about an intense high and a level of THC that is through the roof. And for some people, that's exactly what they need. But for most people, especially if you're starting from scratch with cannabis, you will literally try that concentrate and you will be on the floor. And that can be a safety concern. So when we talk about concentrates versus flower versus tincture versus patches and topicals, there is a ladder. There's a ladder of safety from, you know, experience. And the last thing I would say about the sativa question is, if I am a smoker, if I smoke sativa, I will go to sleep, which is the opposite of what most marketing around sativa products will tell you. It'll tell you it'll help you concentrate and study. And that could be very well true for some people, but that's the whole point of getting to know cannabis, and if it's right for you, what type is right for you, and what its effect is on you. Very individual.
I want to go now to a question that is again about safety, I think, and it's, why is marijuana so scary in the eyes of the whole country, and yet here we are saying it's safe? You know, of course, we've got some cannabis evangelists on the panel, but I'd love to hear your thoughts on, you know, why there's still this perception that marijuana is dangerous. You know, I grew up hearing that marijuana was a gateway drug. For example, I went through the DARE program in elementary school, and that was, you know, kind of what was pounded into our head. So, yeah, what might you say to someone who is just skeptical about this whole "it's totally safe" claim?
Well, it has been around for thousands of years legally, up until about 1937 when it was criminalized here in this country. And ironically enough, around that time, aspirin was discovered too. So the medicine has been around for thousands and thousands of years, but it was, again, criminalized in this country. And because it is still a Schedule I medication at the federal level, that's where the stigma comes in. The states, what are there, 25 states, plus the District of Columbia have legalized cannabis at the state level, but it's still a federal Schedule I medication. And until it's descheduled off Schedule I, this is where the stigma is going to still remain. That's why I was mentioning earlier about, you have to understand that it's still illegal at the federal level. So as a cannabis advocate and as a cannabis person who's considering using this as a medication, you need to know what your rights are and things, penalties that you could possibly still face. That's important to know as well.
So I believe that it became illegal back in the time of the Reefer Madness movie, and the movie was very much propaganda. It was made illegal in part because of the fact that there was a belief that it was people from China, people of color, so Hispanics were the people that were using it, and they were going to run wild through the streets and they were going to rape white women, and it was a horrible drug. And I think that one of the reasons that happened was because there were white men in power with a lot of money who had a monetary reason to keep it illegal. If I own a drug company that's going to charge you $400 for a legal medication, whether it's going to help you or not, then it behooves me to make sure that cannabis, which is possible to grow in your own backyard, isn't available to you. So that stigma holds out. You see it in movies, Cheech and Chong. There are all sorts of things that we did that people thought were funny, but that they added to the stigma of cannabis. And I think now that the cannabis industry is paying absolutely ridiculous amounts of taxes, that many states now want to legalize it, and we are going to continue to see changes. But originally, I think that it was because of who they perceived as making money from it and using it. And Carrie, I think you had something really critical to say.
I am from the South. I'm from South Carolina. I cannot go home right now because cannabis is the way that I function every day. It's the only medication that I take that gives my life back to me. And the simple reasons why it is still illegal in South Carolina and in all the other states are power, money, and control. Let's talk about power. when you can control parts of the population that you want to be able to control, that gives you power. When you can use those people to make money off of them, it is going to be really hard for you to be persuaded to let go of control. So if you think about the prison populations that are in states where it is illegal, and you think about the products that they make for free for a very select number of companies that are usually run by powerful white men, you can see that the cannabis landscape is crafted by white supremacy. It is so simple. It is connected to every single power struggle that we're still seeing today. When you're talking about, the FDA and how they are controlling it as a Schedule I substance, there's a reason why. Go back to when cannabis was first outlawed. Yeah, they went about it in incredibly racist ways, but it really came down to the DuPont family. Just look at your history. The DuPont family wanted to be able to use their chemical companies to produce the goods of the land. Hemp was being used at the same time, and it was growing at such a fast pace that it was going to outdo cotton and plastic. So it's seriously about how our systems are set up for certain people to reap the benefits and other people to be controlled.
So power.
Power, money, control.
Yeah, if you're online in any of the cannabis discussion groups, we recognize cannabis is legal in California, but the prison population for low-level cannabis misdemeanors is the people are in prison for nothing. For somebody stops them, and I tell people, don't, if you buy cannabis at a dispensary, don't put it in your front seat, put it in your trunk. So if a policeman happens to stop you, it's not laying there. And when I say happens to stop you, most likely they're not going to stop me. I don't fit the profile. I'm an old white lady. But you have to be careful. And almost all of us has a horror story from at least a friend, if not a family member, who's been stopped for something that nobody else would get stopped for. So we're seeing changes. We're hoping for more changes. The industry is going to have to make some changes in order for us all to be able to use it successfully. I think that's it.
And know your history.
And that prison population, most of those people look like me.
Yes, they
do. And I have a saying: the money's in the medicine, it's not in the cure.
Yep.
Got it.
Yep.
That's
if you can make a lot of money making somebody a chronic customer from your pharmacy,
yes,
when they can grow plants and learn how to process them themselves in their backyard, you lose a customer. Yes. And that's a really sick way of thinking, but that's why we don't have universal health care in our society. That's why the pharmaceutical industry and lobbying industry is so corrupt. And unfortunately, this is all, you can Google it. You can look up who the first drug czar was and see that he married into the DuPont family, and then all of a sudden, bam, cannabis became illegal. I mean, it's know your facts.
Yeah.
Whew, thank you for just zooming out and educating us on how this conversation about cannabis just ties right into these bigger conversations we're having about white supremacy and systemic injustice in our country. I feel like I want to just use the rest of our time here to kind of think big on that bigger level, and actually just ask each of you, why should we care about cannabis? Like how has it been important in your lives, and what's motivated you to be up here sharing the benefits and talking about why it's important.
And I guess I can start. I've worked in a variety of settings. I'm from the University of Chicago, where I worked in the Department of Psychiatry. So I saw people with mental illnesses who were successfully medicating with cannabis, who had tried psychotropics that gave them side effects, and they found that they could get a lot of what they needed smoking pot. It was acceptable in the 60s and 70s to kind of smoke with your friends. Nobody made fun of you if you were hearing voices, if you were high. Both my parents died very painful deaths with lung cancer, and regular medications didn't work for them. I worked in long-term care, and I had never thought until recently to tell my kids, don't put me in a long-term care facility. But now with the infections, I'm a little bit worried about that. But what I know as an RN, as a senior, as a 75-year-old, that it helps my knees. It relieves the inflammation in my knees and makes getting up easier. It relieves my mind when my brain is saying, oh my God, oh my God, oh my God. Again, I have to sleep sitting in a chair. And I used to always think, I don't know how many watch Sanford and Son, but I would think, oh my God, Elizabeth, I'm coming. It's the big one. I would think that I was going to have a heart attack, and you can think yourself into all sorts of things. And what I found is with cannabis, I can level myself out. I can logically think about what's going on in my life, and I can enjoy it much more than before. And that for me is the critical thing. Successfully aging where I want to be. And so that's my hope for anybody who might be listening to something like this. If a friend has scared you, there is a way that you can use cannabis. And there are people like the three of us who would be more than happy to help you learn more. That's it. You're on, Rube. Reba, what do you got?
Well, actually, I think we have a few minutes left, and if we have time, I'd love to hear from Sibyl and Carrie too, your thoughts on why this matters.
Well, for me, growing up as a little girl, I watched both of my parents take a lot of medication. They had their pill box. And from that, I just had a phobia against pharmaceutical medication, not really realizing the impact that it have on your body until I went to nursing school to, study medicine, and you learn about the side effects, the benefits, the risks versus the benefit. And then I worked in hospice, and I'm here in California and became legal, and I'm kind of a natural girl. So I just started to dive into it to study to see what the medicinal values of it was. And even with my personal self, even with food, I don't like artificial stuff. I like real food, so to speak. So, and with my study with the herb, I realized it's an herb. It's God's gift to the universe because of all the medicinal values that it has. Not only does cannabis medicinal, but all the herbs, the sage, the chamomiles, the peppermints, all those herbs have medicinal value. So to me, it's just a no-brainer. I mean, back in time, the old world, the Arabias and the Saudi Arabians, they were trading herbs and spices. So they just have medicinal values. And so me diving in, and now there's information. So I'm just a believer, and I'm an advocate for it.
Nice. I would say I had the misfortune of being very sick when I was 25. I got shingles, and before I knew it, I lost a quarter of my body's nerve function, and I couldn't use my left arm at all. I was lucky in that we moved from Georgia, where it is very illegal, to California for my husband's job, right when I started understanding the depth of my injury. And I signed up for Stanford Pain Clinic. I signed up for rehab, for physical rehab, for drug trials. I tried literally everything until I couldn't recognize myself anymore, and I couldn't use my body anymore, and I couldn't leave my house anymore. And the only thing I ever did was go to the doctor and the pharmacy. When I finally started understanding that I was saying no to everything in my life, and that anytime I asked about my future, my doctors were only grim, that's when I started turning to cannabis to get off of that medication. All of the medications that slowly get layered up if you are on the unfortunate circumstance of having a complex chronic medical condition. Because of that, I can talk now, whereas I literally couldn't remember nouns before. I can use all of my body. I used cannabis in physical therapy and massage therapy to break up my frozen shoulder to the point where I could get it 100% back. And then lo and behold, I got pregnant because of cannabis. So I think that there is a way that, for me, cannabis has been the yes answer. Yes, you can have your life back. Yes, you can have control of your life back. You don't have to put your life at risk taking medications and treatments that are not the best choice for you and are not going to lead you to fulfill what you're here for. And that's to have a meaningful life. And so now that's why I spend my time helping other people navigate that. It shouldn't be this hard. So let's change it.
Thank you so much for sharing your personal testimonies and clinical and experiential wisdom. I think I've learned a lot, and I hope that everyone listening has. I'm going to turn it back to you, Twin, to take us out.
I also learned a whole lot, and I want to thank every single one of you for being here, especially our panelists. To the participants, I want to let you know that the focus of this event was to, I think by the end of it, we pretty much all of our discussions went towards stigma. And this panel, this lecture, it was kept all very surface, especially because this is a new topic that we're doing for Community Health Resource Center. And we wanted to introduce you to people who had anecdotes, who worked with patients, who went through trainings to learn about the history, the policies, and the science. They have plenty more to share. And unfortunately, we don't have all the time in the world to go into all of that, but also because we wanted to give you a little bit of a teaser to start looking at the stigma that we as a country look at cannabis with, and to just slowly just question for yourself and research for yourself. Obviously, you can tell how cautious we were being with the information. You probably remember Barbara saying, "Don't quote me, I'm not an expert," or we didn't name any specific dispensary or anything like that, because that's not the point of this presentation. The point is to show you that all of the fear that's driven into this one topic, it's really quite an unfair funnel of fear. And yeah, there's a lot of history behind it, a lot of institutional and systemic injustice involved as well. And I'd just like to conclude by first thanking our panelists and thanking Reba for the fabulous facilitation. I enjoyed the conversation from start to finish. And you want to see yourself.
Thank you so much. I'm leaving.
Yeah.
Bye, guys.
Thank you,
Bye.
Barbara.
Bye.
Thank you, Carrie. Thank you, Sybil.
Bye.
Thank you,
Be
Reba.
safe. Okay.